A very warm welcome to all you wonderful audience. I am Dr. Vandana Thapar Bhalla, IIT Roorkee pass out batch of 86. It's my proud privilege to be your host for today's session. Our guest tonight is the very well-known personality, Dr. MC Misra. We are grateful to him for his constant guidance and support. But before we begin, let's seek the divine blessings. शुभं कुरु त्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणं आरोग्यं धनसम्पदः. Under the mentorship of Dr. MC Misra, ex-director and Dr. A.K. Misra, IAS Special Secretary Transport Uttar Pradesh, an informal group in the name of India Duty Group was created on April 30th this year. This group is led by indefatigable Mr. Vijendra Singh, a Dubai resident and an IIT Roorkee alumni. Various people from Dubai, whom we call as Dubai Extended Family, and from IIT Roorkee alumni group got connected, and an initiative was started to help our motherland in this difficult time of the pandemic.
सॉरी वंदना, थोड़ा आवाज नहीं आ रही है आपकी प्रॉपर्ली. वंदना जी, थोड़ा आवाज.
अब आ रही है सर? Is
now it's better? Yes,
it's better. Okay. So funds have been raised from friends and families of Dubai Extended Family, IIT Roorkee alumni, and immense support has come in from Dubai, Switzerland, US, Oman, and India. I hope I'm audible now.
Yes.
Thank you. Till date, we have been able to provide the following support. India Duty Group tied up with an NGO in Delhi, Swastagram, and created an inventory of 20 oxygen cylinders of 50 charitable basis, and till date, more than 40 people have been helped. COVID Care Center has been set up in Bijnor, Uttar Pradesh, which is fully funded by the India Duty Group. This center has also been provided with 8 oxygen concentrators. COVID hit needy people are provided initial oxygen support along with isolation facility, doctor consultation, nursing facility, food and medicines, all free of cost. COVID Care Center was set up by some friends in the government hospital of Pushkar in Rajasthan. All facilities were set up by them, including doctors, medicines, and food. India Duty Group has supported this center with 5 oxygen concentrators. We are trying to help them with 2 more. A group under Digambar Jain Shiksha Samiti Agra has been helping local needy people by providing oxygen concentrators for use at home. They have also been providing free food and medicines to such people. Our group helped them procure 3 oxygen concentrators to augment their good work in Agra. Vihangam Yoga Center in Allahabad runs a 50-bed Ayurvedic center. It is equipped with skilled doctors and therapists. In COVID times, they have been providing assistance to COVID patients free of cost with all services. To help them care for early stage COVID patients, the India Duty Group has provided 5 oxygen concentrators to them. Under the patronage of Seva Bharti and supported by few of our group members, a 50-bed COVID care center is operational in Noida in Uttar Pradesh. Given the current rush of patients, more OCs were needed there. The group has provided this center with 8 OCs. Swastagram has set up a 25-bed COVID care facility in the MCD School of Kittorni in collaboration with the area municipal councillor. 5 OCs have been procured for them, which are arriving shortly. We are at the moment exploring providing help in various forms to proposed locations of Shamli in Uttar Pradesh and Jammu. 6 more 10-liter oxygen concentrators are in transit, and they should be reaching Delhi very soon. An expert panel of doctors has been created from within the group. All doctors have been kind enough to provide free teleconsultations to needy people on a regular basis. In fact, no words of thanks and appreciation will be enough for our mentors, working committee members, as well as each and every person of this group for working selflessly and putting in tireless efforts in this difficult time. We look forward to continued support from all of them. Informative sessions about COVID 19 and its related issues are being organized periodically. The inaugural session was undertaken by our mentor, Dr. M.C. Misra himself. Another was held on 13th May by Dr. Y.B. Agarwal on home isolation and post COVID care. More such sessions are in the pipeline. Today, we are honored to have Dr. Misra again, and I, on behalf of India Duty Group, extend my gratitude and appreciation to Dr. Misra. Professor Misra was associated with AIMS for 37 years before superannuating on 31st January in the year 2017. One of his greatest contribution has been towards the creation and development of the AIMS Trauma Center. He has been the recipient of many awards and recognitions, including the Honorary Fellowship of Royal College of Surgeons, Edinburgh and Glasgow in the years 2017 and 2012 respectively. He has 50 national and 150 international publications and 4 books and 50 chapters till date. Today, Dr. Misra is going to share with us myths and facts of black fungus, a deadly infection claiming lives in recent times. I request everyone to stay muted as the online platforms have their protocols for the optimum benefit of listeners. Please type your questions and queries as they come to your mind in the chat box. Dr. Mishra shall address all of them at the end. I now request Dr. Mishra to take the screen space and address our audience. Please, sir.
Thank you very much, Vandana ji and India Duty Group, Vijendra ji, for organizing this awareness session for one and all. And when we undertake such sessions, we also become a little bit more aware of the problem because we go through the issues related to the problem. So black fungus, so it is being popularly called today in COVID-19 patients. We'll just discuss what is the disease and what is the treatment. This black fungus is basically a fungi known as mucormycosis, and it causes disease what is mucormycosis, and it's a serious fungal infection, otherwise rare. We don't see it every day, and it has been observed recently in number of COVID-19 patients, and surprisingly in those patients who were not hospitalized and they recovered from COVID, and after an interval of few days, they started having some symptoms which were suggestive of mucormycosis of the head and neck area. There has been no major outbreak as such. These cases were first noticed in Maharashtra, Gujarat, then Delhi, then UP, and practically every state now is reporting such cases. So as I mentioned, it's a rare serious infection, like we have viral infection, which is COVID, all of us know. and bacterial infections. And this is a group of fungi known as mucormycetes. And all these fungi spores are naturally present in our environment like bacteria and viruses. But it mainly affects those who are on medication for health related problems, which reduces their ability to fight, that is, reduces their immunity. Then these individuals find it difficult to fight these environmental pathogens, which otherwise do not cause any harm in a healthy individual. But those who are immunocompromised, it then affects them adversely. It is also prone for those who have sinus disease in the head and neck area, where there are these frontal maxillary sinuses and lateral sinuses, and also we can inhale these spores in our lungs. Generally, if we inhale, the body will take care of it. If we are healthy and we are not immunocompromised, these fungal spores from the air. But those who are severely diabetic, and that diabetes is also not well controlled, and also some of these people who are on cancer chemotherapy, they have undergone kidney transplant, liver transplant, and various kinds of other problems, they are prone. And generally we were observing this problem in admitted patients in the hospital, those who were admitted to our critical care units or undergoing kidney transplant or liver transplant. But surprisingly, those who are recovering from COVID and going home or remaining at home, developing after some interval, is most surprising experience for all of us. And this was never expected. Now, reasons for this in this current second wave of infections, when we have analyzed and hypothesized that why should it happen to them, of course, the immunity is one aspect of it. Uncontrolled diabetes is another aspect of it. But then a lot of these people are also receiving oxygen support at home and also in hospital. And at home, what happens, we are not sure how many of these individuals, naturally the research will tell us later on, they got this oxygen cylinder which contained not medical grade but industry grade oxygen. That is also something which we have to keep in mind. Well, was it a medical grade oxygen or the industry grade oxygen? Then the water through which we humidify this oxygen, also if it is not changed frequently, or if it is not sterile by boiling or distilled water, then also it actually encourages fungal growth, which we may not see otherwise, and people may inhale. And that is where this mucormycetes poses a threat. Otherwise, in healthy immune system, it does not. So what happens when one contracts it after one gets recovers from COVID? The warning signs include pain and redness around the eyes and nose, with some fever again developing. They had fever of COVID, but that was all right. And after some interval of few days or 1 week or 10 days, they may again start getting fever, headache, cough, shortness of breath, then maybe some bloody vomit, altered mental status, which suggests what we call rhinocerebral mucormycosis. That is where then the sinuses get affected. This is around nose, and that from there is a connection from the blood vessels through to the brain, and that is where it reaches our brain and then affect the eyes from the back, the tissues around the eye, and that is where they develop this blurring of vision and also double vision. And the sinusitis, what we call generally, is the nasal blockade and congestion, nasal discharge, which could be blackish or bloody. Then local pain on the cheekbones here, and one-sided facial pain, it may be numbness or swelling, and then blackish discoloration over the bridge of the nose here. And of course, if we look from opening the mouth inside on the palate, talu जिसको बोलते हैं, वहां पे blackish discoloration हो सकता है. Then if the jaw gets involved, which in invasive mucormycosis it does get, then loosening of teeth can happen, but that's a late sign. And as I mentioned, blurring of vision, double vision with pain in the eye may look protruding outside, and also there'll be this dropping of the lid, ptosis, what we call, and it will lead to thrombosis, necrosis, skin lesions, then chest pain, and also involvement of the lungs, having some fluid in the chest, and then it will also lead to worsening of the respiratory or breathing symptoms. So one has to recognize it early, and if we can recognize it early, there is, or in this wave, that many patients have received steroids, high dose of steroids for treating the lung condition, which was developed because of the COVID infection. And that is also in a big way responsible for, because these steroids have not been optimally used. They have been overused, what we call misused, like antibiotics. And that's how the antibiotic resistance take place, the overuse, misuse, abuse of these drugs. So are the steroids. What people start self-medication, and they get this fever or symptoms of COVID without realizing that if we take these steroids in the first week of infection, the infection can worsen actually. And then also, because steroids are anti-inflammatory agents, but they also basically reduces our immunity. It adversely affects our immunity. So these basically steroid use and also has led to this problem of mucormycosis in a big way, and particularly in patients with diabetes, because when we take steroids, the diabetes is exaggerated. The diabetes increases, the blood sugar levels increase, and if we do not correct those hyperglycemia, what we call it, the raised blood sugar levels, we do not control it with appropriate and optimal medication, and if it is remained uncontrolled, then these are the groups which are more prone for mucormycosis or other fungal infections also, which is known as white fungus, that is Candida and Aspergillus. Now, one can prevent it by giving oral this antifungal medication, something called posaconazole, along with steroids, so that it doesn't develop. And even when earliest symptoms we recognize any of these symptoms, and these patients who have recovered and they are feeling something different than what they had some few days ago, then they must consult a ENT specialist, maybe a ophthalmologist, eye specialist, or a dentist, and maxillofacial surgeon, depending on their symptom. But ENT specialists are the most sought for to identify and diagnose by taking a biopsy of nasal mucosa. So that is something which we need to be aware. Naturally, it is more common in those who have been admitted to critical care units, put on ventilators, put on various medications, which reduces the immunity. So, but in this wave of infections, it has happened in domiciliary patients who have received oxygen and steroid at home. And mucormycosis can lead to loss of upper jaw, because those patients who require surgical debridement, what we call, because of the invasive mucormycosis, they may lose this upper jaw, sometimes even the eye.
यार
And
तुझे कितने क्यों तुम लोग पता नहीं यार, मैं कितना सब लोग, मुझे नहीं समझ आता कि
these
करना
patients,
बेकार क्यों
even
है.
after surgery, their prognosis is very guarded. When we say guarded prognosis, that means prognosis is not good. And majority of these patients do not pull through these procedures, because the fungal septicemia is linked with increased mortality. And that is something which we have to remember. That is why early diagnosis and treatment is the key to success. And above all, prevention is something which basically is the best policy. So how one can prevent it? One must remember that it's a rare disease. Although we are seeing more number of cases, but still if we look at the total number of COVID patients and the number of mucormycosis patients, it's not that huge. But since we are seeing cluster of these patients recently, and more so after recovery from COVID, that's why there is more cause for concern. And then on top of it, the liposomal amphotericin B, which is the drug of choice in mucormycosis, particularly the invasive mucormycosis, because of the large number of patients coming in over last 2 to 3 weeks, has led to shortage of this drug also. So what I've been telling a lot of doctors, that even if you don't get liposomal amphotericin B, which is the drug of choice, it has toxicity of this drug is less than the conventional amphotericin. So if we are not getting liposomal amphotericin B, one can use the conventional amphotericin B, which has been available, and we have been using it for last 3-4 decades. At least these patients might survive, and then if at all they develop kidney toxicity, that can recover with passage of time. So what predisposes patients is uncontrolled diabetes, immunosuppression by steroids, prolonged ICU stay, and other comorbidities in terms of post-transplant or malignancy, that is cancer, and also any antiviral therapy, which like remdesivir or tocilizumab, or even other antiviral medications, because these are all immunosuppressive drugs. So basically, what we advise, that we must use masks, but masks also, I will caution here, many people may be using linen masks, which they may not be washing it every day. They may be reusing it number of times. That also will lead to might lead to fungal spores in those masks, and that is also some, this hygiene of these masks has to be meticulous. And as I mentioned, whenever you are going out, avoid dust by using masks, clean masks basically, and also wear shoes, long trousers, long sleeved shirts, and gloves while handling any soil or gardening. Generally, those who are recovering from COVID must not handle the soil or the manure into their gardens or in the field, and maintain utmost personal hygiene and generally good bath. That would basically prevent this medication. Now, because these there have been sporadic cases, but the number itself suggests that it is in epidemic proportion, but it is not in epidemic proportion, I must say. Then because these are all collected cases from all over the country, so maybe 150 cases or 200 cases, but surely the number has increased suddenly over last 3 weeks. And that is like some people say that they were not seeing maybe 3 cases in a year, but suddenly they have seen 25-30 cases. Like in Gangaram, they were mentioning they have almost 48 patients admitted, and some of them were waiting. So surely the incidence has increased in recent past, and one has to actually prevent it as far as possible. Those who are taking heavy dose of steroids must take preventive antifungal medication, posaconazole, and also discuss with their doctors the dose and the duration of steroids. And then also with first symptom, different symptom, one must consult the ENT specialist so that they can do endoscopy and see if there is something building up in the sinuses or in the nose, so that the biopsy can be taken, and then that can be treated before it becomes invasive and requires major operation. And despite that, the outcomes are not encouraging. So that is something which we all must remember. Don't panic, but take these measures. Prevention is the best medicine, best cure for anything. So in the first place, prevent COVID from happening. But if it does happen, then have optimal treatment for it and also think about it. Just keep that in mind. So after you recover, just keep that in mind. Any symptom again appearing, one should have a high index of suspicion. That is what we say. And get your checkup done. And in case it is there, it can be treated. And if it is not there, that's a happy ending. So with that, I'll end my discourse, and we will welcome some questions if there are any. We would like to take them. Thank you, Vandana ji. So we can take some questions if there are any.
Yeah, thank you, Dr. Misra. That certainly was very, very informative. And I'm sure all of us have hugely benefited from this session and with more insights to this new deadly dimension of COVID. So we will address the questions. I'll just open the chat box and I request everyone to keep typing in their questions. We'll take it up one by one. So, sir, the first question is from Mr. Ashok. He says that his daughter Divya is feeling panic attacks, anxiety after she got cured from COVID. So what could be the reason? And also if you could suggest some treatment for her.
Yog, sakaratmak soch, confidence, saying yourself that you are okay. Talk to your papa, talk to me, and will instill confidence. Divya, you are too young, and don't worry, you are all right, and you will remain all right. So don't worry about it. Yes, these are difficult times. If you are alone, you have nobody to talk to bring out your emotions. It does happen. So you have to talk to someone to bring out your emotions, your worries, your concerns, and they can be very well addressed. I think you should do that. Do some yoga, do some what we call Brahmari, do some the Anulom Vilom, and that will give you and listen to some good music, whatever to your liking, whether it's a flute you like or you like any other type of music, ghazals if you like so, or any bhajans you like. I like Jagjit Singh bhajan in the morning. In the afternoon, I love to listen to the ghazals. So there is a timing also. I think you could do that. I think music therapy is the best way to relax. Just close your eyes and listen to the good music. That's it.
I fully endorse that, sir. It's a personal experience. I think music is therapeutic. It is a great relaxant.
Because we use it in hospitals.
Okay. Sir, Rajiv has put the next question and he wants to know what precautions a sinus patient who has not got COVID so far, what precautions should he be taking?
I think it's a very pertinent question. Those who are having sinusitis or nasal blockade, I think they should definitely use Jal Neti. It does help. That provides hygiene to your sinuses, and because the whole airway tract or our GI tract is full of bacteria. All the time we are inhaling a lot of bacteria from the environment. So it does give you opportunity to clean that. And that is something comes very handy to clean your nasal passages, airway passages. And then also all these pranayams and Anulom Vilom, Kapal Bharti, all those things keep doing so that your respiratory reserve, your lungs are tuned to expand. And even if you get COVID, one should keep doing that. So, and because that is the biggest problem we are facing in this time. Those who are getting admitted are having the lung issue. COVID has settled. The fever has gone. There is no virus in the body, but that inflammation because of the virus into the lungs, which is the uh, seat of problem.
So the next question is by Saurabh. He wants to know whether MRI can diagnose presence of this black fungus.
MRI can diagnose, and people have done MRI. If I check here what it says about MRI. So what they say that gadolinium enhanced MRI can differentiate vascularized and avascular mucor thrombus structures. But let's not get to that stage. I think we should preempt that stage, because by the time you are able to diagnose with CT or MR, it's advanced disease. So we would like to detect it much sooner, when as and when there is little bit of black crest in your nose mucosa, or you are getting little headache, or you are getting little swelling which was not there 2 days ago, and suddenly you notice that, get your checkup done, and in case it is there, start medication and it will settle down. The fungus responds to antifungal medication very well, very quickly. So that is something we can do. But once it becomes invasive, then it is very difficult to eradicate it. Then even after surgery, even after giving antifungal medication for prolonged period, we are unable to eradicate it for ever.
So Rajiv's question is that his mother-in-law is diabetic and she's recovering from COVID and expected back home after 10 days of hospitalization. What special care and precautions need to be taken?
If she has received steroids, I think it's a good idea to also ask the doctors if she can take antifungal medication along with it. Because since she is diabetic, would be at high risk of basically for fungal infection. So if as a prophylactic antifungal medication also can be added to this protocol, whatever she is getting of steroid, I think that is something he can discuss with his physicians.
All right. Next question is by Yogendra Ji. He wants to know what is the role of voriconazole in this treatment. I don't think I pronounced that right.
Voriconazole. That's
Yeah,
basically, again, it's a antiviral medication, and it also leads to, or maybe even it might be antifungal also. So that is something can be given, but again under the supervision of doctors.
Then, sir, there are a series of thanks for you. They have found your session very informative. The next question is from Sri. How invasive is black fungus in kids? What symptoms must be observed in kids before exposing to hospital environment?
I think the children also, those who are immunosuppressed, they will have the similar symptoms actually. And also, fortunately, even in this second wave, we didn't have too many children basically coming in the hospitals. If you look at the figures, in the first wave, we had 4% children were affected in India. If you look at US data, there almost 8.5% children were affected. But most of them, they recovered without any consequences of severe COVID. In this pandemic also, I have spoken to many doctors, pediatricians, but they haven't experienced large number of children coming to hospital. But yes, occasionally, because in children also we have all kinds of diseases, they also suffer from cancer. If their immunity is compromised, they are also prone for the same. And we have to then have a high index of suspicion in children also in case they are developing any symptoms. So with any symptom after recovery, if one is experiencing, one should actually consult ENT specialist so that they can through scope, they can look at, in magnification, they can look at the nasal passages and sinuses and take biopsy for diagnosing.
The next question is by Dr. Manju Pruthi. She says some doctors advise not to take humid air or oxygen, as is the normal course being administered in the hospitals.
Some doctors said not take humidified oxygen.
Yes, that's right.
Yeah, basically, humidification is done so that dryness doesn't happen in the respiratory passages, because respiratory passage, if there is dryness, then there is it is irritating, and we need some kind of a humidification of the respiratory system. So humidification is generally done for whenever we give oxygen. And with that also, sometimes if there is congestion in the lungs, some like steroids, that budesonide and all those can be added to this humidification. So generally it is recommended, unless there is a specific reason for not recommending it. I wouldn't know that if there is any reason for not to do that, but because as a rule, humidification is advised.
I think what she meant was, doctor, because I have also been reading that the water is coming through pipes which are probably, they have rust, and because of that, the black fungus can be.
What happens when we have this oxygen pipe, and the oxygen is flowed through the water? That's what I said. If you are not sure of the hygiene of that water, then naturally you would not do that. And that's what I said at home. Because if you are not careful of changing that water frequently, and if that water is there for 3-4 days, the same water, then that will put you at a risk of developing these fungal spores into that water. And that could be one of the reasons. So you have to change that water frequently. It should not be left, remove it every few hours and put fresh water or boiled water or distilled water into it.
That explains it. Philip has a question. He says, few states have declared fungus as an epidemic. Is this fungus centric to India only?
So far it appears so, because we have large number of infections, large number of people are on steroid therapy, and the states have declared epidemic, I think, for the simple reason that the amphotericin B has gone in short supply. So that, and there are circulars from the government. I saw one circular from UP government directing the commissioners and the district magistrate to see that these medications are available and their sale is bona fide. No malpractice is happening. I think that is why they have created separate wards also for these mucormycosis patients, because definitely the number we are seeing much larger than what we would see in non-COVID situation, as we would not see maybe even once in a year such a patient. But these days, people have seen 20, 25 patients, and we want them to be treated as soon as it is diagnosed early and treated, because once it becomes invasive, then irrespective of what we do, the outcomes are not good.
Mr. N.K. Sharma is asking whether black fungus can spread through the ears.
It can involve head and neck area, but it is not a contagious disease as such. It's not a contagious disease as COVID infection itself is. So it is not that it will be passed on to another person. It can affect the ear, like head and neck area when we talk. So ear is also part of that. But generally rhinocerebral we call. So because it starts from nose and nasal passages and the sinuses here, and then it goes through bloodstream into the brain, and it affects the eye also from the behind eye, and that's how there is loss of vision, double vision, and proptosis, that is eye projects outside, then lid swelling. and all those things.
Next question is with respect to children. Sri wants to know what extra precautions and activities are good such that 5 to 10-year-old kids may not get the disease.
I think most important for them to basically from their family members only, because these are the children who are staying at home currently. And at best, they are going out in the local vicinity where these are gated communities. They can go out and play in the evenings, which they can do in the open air. There is no risk of infection. But at home, particularly when you are, as a parent, you are going for work and coming back, so you have to be more cautious and keep away from your children for some time. And maybe if you are not sure whom you met, and also generally keep the children at bay, and also your parents, so that you don't pass on, because this in this way what we have seen, that families after families got infection. One person came back with infection, and 3, 5, 10, 20, 22 family members got infection. So that happened.
So Dr. Pruthi has another question. She says that, do you think Ayurvedic can be an answer to our problems?
Ayurveda has a very significant role in recovery from COVID. And that is something one actually IAS officer from Rajasthan shared his experience recently, that how he did all those Jal Neti and many other Ayurvedic treatments to recover from COVID. Yes, Ayurveda has very significant role in recovery, because as such, even if you see in allopathy, there is no definite treatment of COVID. Whatever we are giving these treatments, it is not directed towards virus. It is directed towards the adverse effects of virus on lungs or on mucormycosis. It is not caused by COVID, basically, the mucormycosis. It's a collateral damage which is happening because of your low immunity. So Ayurveda can help you improving your immunity by various whatever you are taking, kadhas and also ashwagandha and other things, chavanprash, etc. And then meditation, and then yoga, improving your lung function. So Ayurveda has a very, very major role in recovery, in improving your morale, in having a positive attitude, and all that.
She further wanted to know, is there any home remedy for treating the black fungus?
Home remedy, I'm not sure, because once you diagnose, I think it's better to take established drugs which have a definite effect against fungus, whether it's voriconazole or it is posaconazole or amphotericin B in invasive mucormycosis. And the fungal, they do respond to these medicines quite well.
Rajiv wants to know that does vapor, I guess he means steaming, does it help as a precaution for a non-infected person?
That is basically if you have no symptom as such, and you are doing your breathing, pranayams, etc. So routine steam, we do go in like the sauna bath and all that. We do that as a healthy individual. So there is no harm in doing that. That will keep your passages clean, but do it in moderation. Anything in moderation is okay. Don't be obsessed about anything. So if you want to do it as a preventive measure, that your whatever secretions you have, you want to bring them out, you feel good, you can do that, because we all go and take sauna bath when we don't need it at that, but we feel good by doing that. So from that perspective, if you want to take, you can take.
Asha wants to know whether black fungus is observed only in COVID patients, or even a normal person can suffer from this.
That's what I told, that if we are healthy, otherwise we have no reason for our immune system to be reduced, then we may inhale, but we may not get the disease. So it is only those who are on steroids, whose immune system is compromised for whatever reason, whether you had undergone kidney transplant, liver transplant, or you were receiving chemotherapy, then your immune system is not working at a optimal level, and that is what put you at a higher risk. So a healthy individual generally will not get it, like any other infection. Even COVID, not everybody is falling sick with the disease. So that is the same thing applies to fungal infections also. If we have a healthy immune system, we can handle that.
Saurabh wants to know that how do we distinguish between black fungus and a normal sinusitis?
Basically, you know your symptoms already. If you have sinusitis, that what kind of symptoms you get, anything different than that. And also in this, why it is called black, because there is some black crust happens inside the nose. So anything different you notice, suppose you are not getting headache so often, or eye ache, or swelling on the lids, or maybe one-sided symptoms, the numbness on the face, or headache, or heaviness. So I think that should raise suspicion. And if you go and get your checkup done and you don't find black fungus, that settles the issue basically.
So Dr. N.K. Rana had two questions. One of them has been answered. The second question is that can black fungus grow in the mask that we use?
That's what I said, that if you are using linen mask and repeatedly and not washing it every day, or have two masks, maybe you can use one in the morning, one in the evening, and then wash it, dry it in sun, and then use it. Then one will not get it. So it is just suggestion from some people that some people are using linen mask and not changing it for a few days. That can put us at risk. Otherwise not.
Shalini Gupta wants to know, is RO water okay to use in the humidifier?
RO water is okay. If you think that your RO is working all right, then it is okay. Otherwise, boil the water. That's very simple. Boiling water, boil the water. That is the surest way of removing anything in the water, any contaminant.
Mr. Malu wants to know that whether a asthmatic or a bronchitis patient take the COVID vaccine?
Yes, they should rather. They should take the vaccine.
Abhinav wants to know that is it good to use a small amount of hydrogen peroxide in the water for humidifier? Will it avoid the fungal growth?
I don't think one should do that. Because you don't know, hydrogen peroxide, we use it to clean the wounds. So I don't think we should put in our lungs that way.
So there's another question which says that there are certain fruits which have black marks like banana, ginger. Is that black fungus?
No.
Is there a known homeopathic medicine available for treating the black fungus?
I would not depend upon that. Even if some homeopath claims, I would not depend upon that. Take established allopathic medicines for antifungal treatment.
Then there are again so many thanks for you, Dr. Misra. I'm just going to skip through them. We will go to the next question. The next question is that can pouring warm ghee drops, ghee ke garam garam ghee, into the nasal tract, will it prevent the fungal infection?
I think you should basically look at what temperature ghee you are putting in, number one. But yes, it is recommended by our Ayurvedic practitioners to put the ghee as a spray. As we are saying, some nasal sprays these days we are hearing but not from fungus, but from virus itself, the coronavirus, that it may not penetrate the mucosa, nasal mucosa. It may help that way. So maybe the fungal also can be prevented, but I think one should not depend upon that. If you are diabetic, if you are uncontrolled diabetic, you have suffered from COVID, any symptom suggestive, could be suggestive, you must get your checkup done. I think that should be the first thing. Have a high index of suspicion. Think of the worst. If it is not there, be happy. That's a happy ending.
So then there's a question from Philip, which I have not been able to understand. It is regarding long haulers patients. Maybe we can get Philip to unmute and ask him yourself. Mute, Philip.
Hi, Dr. Misra. Hi. We have patients up here, quite a few patients, in fact, they're just coming out now. They call long haulers. In other words, these people had COVID, they went through the hospital, they came out, but after coming out from the hospital, they have a severe headache, pain, unusual, symptoms that appear. And even after 1 year, they still have it. And people are trying to figure this out. What is this, So I'm just wondering if you have similar cases.
That's a very pertinent question. There are these long-term sequelae, post-COVID sequelae we are observing. Of course, they are not very common, but there have been studies done and where we have these symptoms related to cardiac issues, related to cognitive issues, what you are saying, anxiety, depression, neurosis, and also forgetfulness. These neurological symptoms, psychiatric symptoms, because this pandemic has the psychosocial dimension is very huge of this pandemic. So yes, what we call in trauma, post-traumatic stress disorder, PTSD. And so such people definitely surely need psychological support, and they can seek psychological or psychiatric help if they are having these problems more often. I think there is a treatment available, there is counseling available to these people, and it is possible because everybody is worried. If I am okay, even they are okay, still they feel, am I okay? Am I not develop anything else? Now, as we are talking of black fungus and all, so everybody keeps thinking, am I developing black fungus, a little bit of headache somewhere? So I think that is where we need more counseling sessions, more psychological counseling sessions, or maybe by your own physician who can counsel you and reassure you. But basically, they need only reassurance that they are okay. And once somebody can reassure them, they'll be happy with that.
Thank you, Doctor. Dr. Vandana, I had a follow-up question on that. Please ignore that question. It is Dr. Misra has just answered that question. Thank you, Dr. Misra. Appreciate your time.
All right.
Thank you.
I think now we have the last question. This is by Asha. She wants to know if 1% CuSO4 can be used in a humidifier. It may help to kill the fungus.
What can be used?
I think 1% CuSO4, maybe she's talking about the copper sulfate solution. Asha, are you around? Asha Agarwal, are you around?
Yes, I am here.
Copper sulfate.
Yes, sir.
Yeah, you mean to say you want to kill them in the lungs, or you want to kill them?
No. When you said no, when oxygen is being given to the patient, then the water is to be changed again and again. Yes. And people are not doing so. So we can use 1% of copper sulfate as I am an ichthyologist also. So when we maintain an aquarium, we put 1% of the copper sulfate solution in the water so that the fishes they do not get the fungal infection. So we can use it there, probably a little less percent or something like that, 0.5% or so.
I don't know, because I don't know how will it affect when it goes into the system. Anything which is
it won't go. It won't go.
No, because there'll be traces of copper would go, but whether they'll harm or not, I don't know. Possibly they should not harm. Such a
It won't harm.
Yeah,
because we do use water in olden days also. Copper vessels have been used to drink the water. We used to store the water in the copper vessels.
Yeah, that
and
we
it has
drink.
a positive effect.
So there is a difference in drinking something. I also drink from a copper vessel.
I too.
I put that in that and then I drink that. I am doing that. But something going into the
no, if we want to avoid the fungus to reach the body, we can use a little bit, maybe less than 1%, say 0.5 or 0.25% of copper sulfate. It may kill the fungus or spores and all. That can be experimented upon.
Where I would again ask, where do you want to kill those spores? In the water?
You said no, the humidifier. We are using water is not being changed
then
by the people. That may also be giving the fungal infection.
I would say change the water, boil the water. It doesn't take, it's not something very difficult to do that. We boil it every hour in our house for drinking purpose. So the same water, you boil it and use it. Don't indulge, because we don't know what, how much, if somebody can put more, somebody can put less. There is no standardized thing like chlorine tablets.
No, it is okay, sir, but it can be made as standardized.
That you make it, you can make it and give it to other people. I don't know. I don't know.
I was just thinking.
No, it's a
while you were giving the lecture.
It's a good thought, but anything which is going inside the system, not in GI tract. I also drink water from a copper vessel. I keep it in the morning.
But I think the copper won't go, only the humid air will go.
Yeah, hopeful that what you are saying is right, but I cannot substantiate it, or I have no experience of it.
Yes, we will think over it and do some experiments. Okay, thank you.
You can do it and let us know.
Okay, with this, we come to the end of the questions. Thank you so much, Dr. Misra. That certainly was very, very informative. I'm sure all of us have hugely benefited from this session with more insights to this new deadly dimension of COVID. Before we end, I just wanted to make one announcement. Our next session will be held on coming Thursday, which is a week from now. Same time, 8 p.m. by Dr. Amit Mehrotra. He's the program head of UNICEF in Uttar Pradesh. The topic will be risk of COVID among malnourished children. He'll be talking about investing in nutrition, why it is significant, mortality and malnutrition. So he will be addressing nutrition in children, in poor children. How is COVID affecting these malnourished children? So these will be the broad topics that Dr. Amit Mehrotra will be touching upon. This will be next Thursday at 8 p.m. hosted by India Duty team. And with this, we conclude our session for today. Grateful to all of you, especially Dr. Misra, who made time for us. Hope all our audience are taking back with them lots of significant. Please take all care, remain optimistic, extend a helping hand wherever possible, and most importantly, take all precautions and stay safe. Have a very good night.
Thank you.
Thank you, Dr. Misra.
Thank you, Dr.
Thank you.
Dr. Vandana.
Thank you, Dr. Misra. Thank you.
Thank you.